Welcome back at The Source. We continue to celebrate Volunteer Week this week. The 700 plus volunteers who usually dedicate their time to Niagara Health have not been able to visit hospital sites during the pandemic. Volunteer coordinator Melanie Neamtz joins us now. Melanie, how have the volunteers been contributing remotely?
We've had a few programs running over the last year. We've had our research volunteers who are supporting the research department through an ICU initiative. We also have our patient partners who have supported approximately 40 initiatives over the last year, attending meetings and committees and things. And then we have a special project. It's a sewing from home project where some of our volunteers are creating adult clothing protectors that support some of the patients in hospital to cover their clothes while feeding, just to give them a little bit of support in that way.
Let's talk a little bit about the clothing protectors. How did this idea come about?
So it really was just an email, an inquiry with a picture. Do you think this is something that the volunteers would be willing to do? And we have a really solid team of volunteers. So I sent it out to one in particular who is very administratively savvy. And she then sent back to me some instructions on how to sew this particular article of clothing. We shared it with our, with all of the volunteers, and we had those who were interested in sewing came forward. And then we needed to find shirts because this is a kind of an upcycle where you take a woman or a women's or men's shirt and you repurpose it for this adult clothing protector. And we have, some volunteers who love to sew, and so they were able to take those instructions and create some beautiful pieces.
Where are you finding the shirts? Are people donating the shirts?
Actually, yes, we do have a third volunteer who's been heavily involved in that. So she's one of our younger volunteers who has reached out to her own group of resources, and she's been able to source about 50 or more shirts for the project, and she collects them for me, and then I do porch pickups at her home to pick them up and drop off then to the volunteers who are interested in doing the sewing.
What is Wishlist Niagara? I understand that they're involved somehow.
Yes. So one of our volunteers is the co-founder of that particular initiative, and that is how she has reached out to a larger group of people to do the donating. And that's the bulk of where the donations of the shirts have come from.
I understand from August till about December that about 150 of your volunteers, regular volunteers, were able to return to the hospital sites during that time. Is there any chance, I mean, obviously right now in the current lockdown, they're not allowed to be in the hospitals, but once that lockdown is over, are you hoping to welcome them back?
Absolutely. We can't wait to see them again. Everyone is very excited to have the volunteers return. They're very special people, and they are there for all the right reasons, and we are very much looking forward to their return.
Are volunteers being mobilized at all during the vaccination clinics?
Not at our vaccination clinic. However, a lot of the volunteers at Niagara Health have been supporting the public health vaccination clinics through volunteering there.
As a volunteer coordinator, when we look at 700 plus volunteers, how do you wrap your head around coordinating that many people?
So typically I'm not a one person show. We do have 4 volunteer coordinators across all of our hospital sites. However, with the pandemic, there's been a lot of movement. Really, over 600 of our volunteers are on email. So I communicate with them regularly in that way. And just an extra little note that I do have a few office volunteers who've been supporting virtually as well. And they assist me in making phone calls to the volunteers who do not have technology to access. So we just, do regular check-ins and making sure that everyone is okay. So
have paid staff members had to pick up the slack left behind by some of the volunteers?
I mean, everything has kind of changed, right? So everything is just a little different than it was before in order to accommodate the COVID protocols, et cetera. So absolutely, staff are missing the volunteers for a variety of reasons, and that being one of them, just being that extra support on a daily basis.